Cataract surgery is the most common surgical procedure that we do as an ophthalmologist. Actually, in America today, it's 3.2 million procedures a year. And more or less everyone that lives long enough is going to need cataract surgery. The typical American undergoes cataract surgery in their 70s, but it can be a problem even as early as your 50s, and occasionally in special situations even in children and young adults. It's a relatively minimally invasive procedure today. We've had tremendous advances in our technology. Most of the time it's done in an outpatient ambulatory surgery center. It's about an hour or two at the center for the total experience. You come in and you see a nurse and your blood pressure is checked and you're given some eye drops to numb the eye and to dilate the eye. And then you're brought into the operating room and the area is prepped in a sterile fashion. And your lids are separated with a small speculum or lid separator. Most of the time we're doing this simply with a topical anesthetic and a little sedation. And typical surgeon today, it's a 10 to 20 minute procedure, so relatively short period of time. First thing we do is to make two very tiny incisions right where the white part meets the colored part. We call that the limbus. One of them is only about 1/32 of an inch in size, and one of them is 1/16 to 1/8 of an inch, so they're very small. And we make them in a fashion where they're self-sealing so that no sutures are required at the end. The eye pressure simply seals the incision closed. And then we go and we put a little fluid inside the eye to protect the inside of the eye tissues, called a viscoelastic. And we take the front capsular membrane off of the cataract. The cataract is an opacification of the natural lens that sits actually right behind your pupil. And under an operating microscope with high magnification, we make the small opening, and then we loosen the lens inside the capsule, and then we remove it with an instrument called a phacoemulsifier. And what a phacoemulsifier is a small handpiece about the size of a pencil with a little tip at the end that vibrates at about 40,000 cycles a second. That's called ultrasound. And basically it emulsifies the lens, and then we aspirate it out. Then we polish that capsular bag so it's clear, and then we place another lens inside. Once we've removed the natural lens of the eye is out of focus. And so we have to replace it. We replace it with a intraocular lens implant. And that goes right back where the natural lens was before, and that restores the eye to a proper focus.